The first segment we want to focus on are modeling and projection, trying to understand how these models are built, how do we interpret them, why are there variations in models. And so our first question is directed to Tyler, and we just wanted to ask you, how should the public interpret models and projections on the impact of COVID throughout Canada? This in the context that sometimes we see variation between provinces, and even within provinces, sometimes you might see different models. So to kind of help us understand how models are built, how we should interpret them, what cautions we should have. Thank you, Tyler.
Thanks very much, Gil. So I think you answered part of that question already in saying that as you see these models, I would prescribe a healthy dose of skepticism. I think that that's probably the most important thing you should be thinking about when you see these types of models. I've been asked, as the provinces were releasing their models, I've been asked a lot by the media around, how do we interpret this? And I think the best analogy I can come up with is, we're at the start, maybe a little bit into now, the hockey season. I know we're not watching hockey, but if you want to draw that analogy, and we're asking, who's going to win the cup? What's the score of the final game going to be? Those types of questions at the end, and we're a few days into the season, so it's really challenging to project well into the future what's going to happen with these things. I think there's three major approaches, and Doug's going to be able to speak to some of the work that they've done in Ottawa around modeling, but there's one of the methods, of course, is mathematical models, and there's been a lot made of those, and there's a number of provinces that have used that approach. Some provinces have elected to use what we see as the experience in other countries to try and give the best projections for what's going to happen in Canada, and try and draw comparator countries. I think consistently we're seeing how much better the situation is in Canada, but there's lots of different ways, and that's part of why we see such a variety in the types of models that are being presented. Do you want to add anything to that, Doug?
Your analogy, I like your analogy of hockey. The one that I've been using is the analogy of hurricane forecasting, and sort of say that if the hurricane's out 1,000 miles from shore, it's difficult to know which part of the shore it's going to hit. A week away, we're pretty good. So we can forecast COVID a few weeks ahead quite reliably. Further out, it's going to be difficult. And just like I think I wouldn't say like I maybe bristle maybe a little bit at that skepticism. I don't think we should be skeptical at the hurricane forecast or COVID forecast. It's just knowing what they're designed for and what they're good and bad for. So I think we can give a pretty good estimate of what's going to happen in the short term. That really allows us to get the capacity up for ICUs if we're projecting we don't have enough or things like that. Long term, I think the real interesting thing is I say, we can't change the direction of a hurricane. We can change the direction of COVID. So I think the real use of the more long-term parts of the models is to do those counterfactuals. What do we need to do to slow this down? And so, although the exact number may be off 3 months, the relative amount is going to be quite helpful. So I would say that's how we're kind of thinking about the modeling in Ottawa. Those two uses: short term, are we going to be okay? Do we need to start increasing our beds? Long term, what are our options and what sort of impact we're going to get from those?